Good day, today I'll be discussing diabetes and the role of the biokineticist in managing diabetic patients. So the agenda of this discussion includes different types of diabetes, type 1, 2 and gestational diabetes, the benefits of exercise in managing diabetes and the role of the biokineticist. So type 1 diabetes is an autoimmune disease characterized by an absolute deficiency on insulin. It is thought to occur in genetically predisposed individuals who are exposed to a trigger that initiates the immune response that destroys the pancreatic beta cells. Type 1 diabetes is commonly diagnosed in individuals younger than 30. Genetics as well as environmental factors are largely involved in the development of type 1 diabetes. Relative insulin deficiency and insulin resistance are characteristics of type 2 diabetes. The insulin resistance halts the glucose absorption in these tissues, leading to an increased blood glucose levels. Possible contributing factors include genetics, environment, and abnormal hormonal secretion. The main risk factors for type 2 diabetes are age, obesity, family history, ethnicity, physical inactivity, and diet. The age of onset is generally after 40. However, with the increasing prevalence of obesity, the number of younger individuals that are diagnosed is growing. And lastly, gestational diabetes is defined as glucose intolerance, first identified during pregnancy. This is diagnosed between 24 to 28 weeks of gestation. Risk factors include obesity, previous large birth weight baby, and a family history of gestational diabetes. So regular physical activity has numerous benefits, including improved mood, higher sleep quality, and enhanced cardiovascular health. Individuals with type 1 diabetes also experience these benefits, as well as enhanced insulin sensitivity, improved glycemic control, increased metabolism, improved antioxidant defenses, reduced blood pressure and heart rate at rest, and enhanced renal function. What this means is that the glucose is getting to where it needs to be, to the correct place. When you exercise, your muscles need glucose and use the excessive glucose from your bloodstream, resulting in lower blood sugar levels. With each workout, your body's natural response starts shifting towards achieving healthier blood sugar levels, resulting in better glycemic control. Additionally, when you have fat around your belly, your liver produces more glucose and releases it in your bloodstream. Losing belly fat, therefore, increases your liver's efficiency to regulate your blood sugar levels. In addition to the benefits like improved mood and enhanced sleep quality, patients with type 2 diabetes also achieve improved glucose control and weight loss, which can aid in reversing the signs, symptoms, and diagnosis of type 2 diabetes. Obesity is a major contributor to insulin resistance, and physical activity therefore plays a crucial role in the treatment of type 2 diabetes, such as decreasing body weight and body mass index, improving glucose tolerance, lowering hemoglobin levels, enhancing the cardiorespiratory system, and reducing the incidence of new diabetic cases. So diabetic patients are encouraged to see a biokineticist to assist patients through risk screening, assessments, and exercise prescription. Diabetes is generally managed by a multidisciplinary team consisting of an endocrinologist, dietitian, biokineticist, podiatrist, and ophthalmologist. Biokineticists must communicate and collaborate with their multidisciplinary team, referring patients to other healthcare practitioners where necessary. Biokineticists can also screen patients for symptoms that will present a risk during exercise. Individuals should exercise under the supervision of a biokineticist who can monitor them by measuring blood pressure and blood glucose levels before, during, and after exercise. This is especially important as diabetic patients are susceptible to hypoglycemia. Biokineticists are involved with health improvement through personalized assessment and exercise prescription for clinical pathology. They can actively be involved in injury prevention by designing scientifically based exercise programs to counter the effects of diabetes. Some exercise testing includes a 6-minute walk test or a cycle increment test for aerobic fitness. Hand grip strength test to measure strength. Timed up and go would be used to measure the functional ability and a fall risk. Biokineticists also play an important role in educating individuals with diabetes and explaining how to manage their disease state. So this is through self-management such as exercise, diet, foot care, and adhering to medication schedules. Management of diabetes includes insulin, which is the primary means for treatment of type 1 diabetes, while lifestyle changes is the primary prevention for management of type 2 diabetes. Additionally, surgical treatment, specifically bariatric surgery, is an additional treatment for type 2 diabetes. And especially for type 2 diabetes, they must be encouraged to partake in regular exercise to manage their glucose levels. Diabetes management generally focuses on management of glucose levels, weight, and insulin secretion. It is also important to address the management of complications associated with diabetes. So some complications include retinopathy, neuropathy, and foot ulcers. So retinopathy results in blindness, and as a result, diabetic patients may experience glaucoma and cataracts early in life. Retinopathy is also related to hypoglycemia. Therefore, managing glucose levels is of the utmost importance in prevention of the onset of retinopathy. Neuropathy has a wide range of clinical manifestations. Individuals with type 2 diabetes should immediately be screened for peripheral neuropathy, while type 1 diabetics may be screened 5 years following their diagnosis. Diabetic foot ulcers are quite dangerous and may result in amputations. Therefore, diabetic patients should undergo comprehensive foot evaluations annually or visit their doctor if they are experiencing any loss in sensation. Lastly, it is recommended that individuals only participate in exercise 60 to 90 minutes following an insulin injection. Thank you for your attention. I hope you found this presentation informative and enjoyable. Please feel free to reach out if you have any further questions or would like to discuss anything in more detail.